Hi, good evening. I'm Elvin Gonzalez from BSN Wonderswan, and today I will demonstrate the head, neck, eyes, ears, nose, and mouth assessment. The first thing we need to do is to perform hand hygiene and put PPE is indicated. Identify the patient with the two identifiers, and you can please state your name and age.
My name is Edward Kendrick Gonzalez. My age is 12 years old.
12 years old.
Yeah.
Make sure to close the curtains and door to provide privacy and explain the procedure to the client and ask questions. Today I'm going to demonstrate examination to determine any abnormalities in these regions, and I need your full cooperation. But before we start, do you have any question?
No.
Inspect the head and the face for color symmetry. Lesson note and not the facial expression. Palpate the skull and inspect the overall skin coloration. Inspect the external eye structure, cornea, conjunctive, and sclera. Note the color of edema and symmetry and alignment. Examine the pupils for a quality of size, shape, and reaction to light by light using pen. Okay, and to test for the popular accommodation and convergence, ask the patient to focus on the object. Can you focus this object? Using an ophthalmoscope, check the red reflex, test the patient visual with the Snellen chart. Come here, sir. First, the left side of your eye. Read.
EFTTOZLPED.
Good. In your right eye.
FPTOZLPED.
Okay, now observing the patient, I can say that he has the problem on his left eye, and with the patient about the 2 feet away, ask the patient to your finger and move the patient eye to the 6 cardinal position of this. The next one is the inspect the external ear bilaterally of shape, size, and vision. Palpate the ear at my mastoid. And perform an otoscopic examination for children. Pull the article down and back, note and ceremony, edema, discharge, and condition of the tympanic membrane. Okay, next procedure is use whispered voice to test hearing as the patient. To cover the ear not being tested and perform on each ear. Okay? Can you cover your ear and whisper? Ah. Ito, Hindi, mahaba. using tuning part to the perform reverse and green test, put on gloves, inspect the palpate that the external. Okay, occlude one nostril externally with the finger while the patient breathes through the other. Mahinga ka dito. Inhale. Exhale. Inhale. Exhale. Inhale. Okay, then inspect the internal noise using otoscope. Palpate the temporal mandibular joint by placing your index finger over the front of each ear and ask the patient open and close the mouth. Okay. Talikod ka. Go, open, close, open, close, open, close. And inspect the lips, oral, musca heart, and palate teeth, so a very blend using tongue, blade, and pen. Okay. Two up. Okay, after all procedure, remove any PPE if indicated and perform hand hygiene. Continue with assessment to specific body system as indicated. Initiate, proceed referral to other healthcare, practitioner further.